Thanks so much. First of all, I think we have an incredible panel here. They are all jury members. So I think if we can begin with a round of applause for them, I think it's very important. I have several sets of questions actually, but if we maybe I think if we can begin with all of them as one connecting link note, as it were. While we as journalists have been kind of cognitively busy looking at elections and what's happening politically, healthcare and economy have two aspects where we cannot really leave sight of. So from a healthcare perspective, the first is about post these elections. Now the question is about what next, and how is it that we look in terms of the way, the journey ahead, the kind of new imperatives that is there. The next 5 years, how should they be in some sense different from what has been in the past? What would be, as professionals and as experts in this area, the way you look at each of them, actually, if I could begin with your thoughts in terms of how you would think, say in the next 5 years, what would be the key items on agenda that you think would be first things in healthcare, which you think need to be looked at, maybe a little different from what has been in the past? If we can begin as a general tone on this with you.
Yeah, thank you, Mr. Kumar. So the next 5 year, as we emphasize, is going to be all about taking safe health practices with access, equitable, acuity to the last in the line. So as we are aware that India has managed to create wonderful islands of excellence. So we have the cutting edge technology, we have the best of the best in hospital, we are reaching there at medical value travel, we aspire to do more, but we are a big and diverse country. It's not one country, but probably we are 36 countries rolled into one. And we are as strong as the weakest link in the chain. So unless we reach out to the last in the line, we are not safe. So the basic adage, which is about thousands of years old, sarve santu sukhani, sarve santu niramya, till everyone is healthy, no one is healthy. So that is something which probably the policy makers have also taken note, and that is something we all should collectively aspire to do. I am sure there are some of the best hospitals in the industry who have received the awards today. So what they could do, their bit, is to mentor smaller hospitals to adopt best practices. What the policy makers would do for GDP level, what the NABH could do to promote healthcare at every level, that of course will be done. But I think it's each person's responsibility to collectively address the issue and understand that future pandemics may be a reality, and till everyone is healthy, till we raise the level of health in everyone, I may label it as herd quality, So we know herd immunity, and probably it's all over the news also again. But herd quality is something. So safe healthcare to prevent unintended harm, to empower every level to the tier 4, 5, 6. There are hundreds of cities there. And I think that's a collective thing we all must do. At the next level. And the next 5 years, next decade is all about going to be, of course, enriching and empowering and upskilling and up-caring everything. But the entire ecosystem must come to raise the level across country as a whole. So that's where we see healthcare happening. There are lots of excitement in the healthcare. We are about to, in like 2030 target for the economy is to be the third largest economy in the world. There's also, it's envisaged by 2035 they are going to be from 35,000 present hospitals. These are the actual India.gov figures which I am quoting. Their government has planned that 105,000 new hospitals, total number of hospitals are going to be registered. And these are not the mom and pop stores. So there are lots of investment flowing in the country, lots of consolidation happening. Lots of beds which are increasing at all levels, even public funded facilities are doing their bit. So lots of positive, there's the health tech which is blooming, and we must also appreciate that technology is the only bridge which is going to lead us there. So first part is that empowering the last in the line, giving them what they need, and second is the appropriate use of technology to take us there. by judicious use, by having standard technology. So this is what we look forward to.
The mood is apparently, I think, from what we can gather, I think the mood was fairly upbeat and I think genuinely infectious. So, but your thoughts in terms of?
Okay, thank you. I think I will just pick up where Atul Mohanji has left. In the coming years, if you are not digital, you are not in healthcare. This is one of the main thing which is there. That means if you have not invested yourself in the digital technologies, then you have to struggle for providing or staying in the business of healthcare. That's one thing. The other thing, in the 5 years, looking from the perspective, that means we are at an inflection point for eliminating many diseases. So we have to see that this neglected tropical disease, which the WHO classifies, that should be our priority. That means we should see that how this disease they are eliminated. Leprosy, filariasis, we are still struggling for that, eliminating such diseases. TB is there. TB is other kind of thing. It is a different program is there. But these are the diseases where we have already reached. With little bit more efforts, we can eliminate this disease. In the Western country, they call it as a neglected tropical disease. Why? We can't neglect this. These are our priority diseases which can be eliminated. That's one thing. Second thing, which is happening, a lot of thing is happening is infrastructure investment. In the health, you are having the largest pan-India infrastructure program, which is known as ABEAM. We can see an extension of this ABEAM program. That means it's around 70,000 crore investment into the healthcare, and you see how the public health infrastructure is coming up. You have seen that how the public health infrastructure has shown its resilience during this COVID time. We could, using the public health infrastructure, because in the COVID vaccination, the contribution of the public sector in COVID vaccination was more than 95%. And all this could be possible because of the network and the investment which we have made in the past, and created a structure where in a single day we could reach around 2.5 crore vaccination shots per day. That was the magnitude and the things which we have planned. That's another thing. Other thing is we are trying to increase the access through your telemedicine services. That you will be seeing a lot in the coming 5 years.
Well, actually, the point is that the key point is actually that we agreed in terms of what the strengths are and what we leverage. One or two specific things when you say, okay, after June, when there is a next agenda which is there in healthcare, among the various things that you have, what would be 2 or 3 things on which we can maybe, we can emphasize a bit more, something that we can, look at when we talk from any dimension?
So one of the important things which needs to be integrated, that is the availability of data and the research.
Data and
research. Research and data needs to be focused, because if the data is made available, because a lot of data analytics and that capacities are required. Data is available, data is generated, but we require capacities for analyzing the data. Across all spheres, be it private sector, be it public sector, the capacity to analyze the data is one of the important things which needs to be at least strengthened in the coming days. Okay. Apart from the other activities which we are doing. Okay. So beside that, we are trying to see that how the access to healthcare is made available. Wherever the specialists are not there, we are trying to reach it through technology. And we are trying to see that how the healthcare is made affordable to all the people. One of the targets of any government across the globe is to reduce the out-of-pocket expenses. Right now it is around projected out-of-pocket is around 48%.
28%.
48%. So we have to see that how we bring it down to less than 20%. That's whole of the aim. You see the many insurance programs.
You're referring to 48 and 28, you're saying it as an overall percentage.
No, 28 I have not sold.
No. To bring it down to less than 20.
It has to be less than 20 or to less than 10. Some of the countries, they try to target it to bring it to less than 10. Why we want to do it? Because if you look at the consumption of expenditure in the country, so most of the people, if they fall sick, at least 1 or 2 months' salary is knocked off. So we have to see that, and around every year, because of this health catastrophe, many of the families from this level, they fall down to this level, and morally at a sustenance level, they will usually come back. That kind of we have to see that how this is more strengthened. Reduction in out-of-pocket expenses, and most of the activities would be geared towards that.
Okay.
So I will take subsequent questions.
Yeah, Dr. Shirshendu, your points on data dependency and all we've been discussing for a long time. Some of the points referred to by the other panelists have also been around the progress that we need to make. Specifics that you think that, when we look at from either innovation point of view, quality point of view, access point of view, among the array of things that we need to do in healthcare, 2 or 3 points uppermost that you think, can be an immediate agenda point.
Thank you, Mr. Sharma, and thank you, financialexpress.com, for this invite today and being a part of this exciting, journey to select innovative, health tech organizations for this. So I think.
Can you be a little loud? Or is the mic not working? Oh. Yeah. Okay.
Hello.
Yeah.
So I think I agree with my earlier esteemed panelist. What the steps they have taken. I will say that the next 5-10 years will be a decade of innovation. Innovation, I represent an organization which literally works on innovation from literally concept to reality. And innovation will be a critical element in the delivery of healthcare, starting from drug discovery to developing good diagnostic tools, to developing vaccines, and the COVID story we all know. Then developing good medical technologies, and these interlinked to the healthcare delivery systems. Innovation comes, and if it is not integrated to the healthcare delivery systems to generate affordable solutions, the innovation doesn't make any sense. We, in a funding parlance, called 360-degree innovations. Innovation has to be a 360, where the science behind the innovation or the clinical aspect of the innovation has to be strong. But along with that, how it's the exit strategy, how it moves to the next level, has to be very, very clearly defined.
Yeah, I was referring to something specific. Like, for example, do you have the National Biopharma Mission, which was very successful?
Yeah.
Lot of companies, 50 companies or maybe more, from small to biggest, say even Sun Pharma, took benefit of that. Now that is beginning to end now. So what next? Is there something else? So what specifics that you can point out there which help us?
You took the national. I was coming to that example. Now the National Biopharma Mission, what it did? It was a very important initiative of the Department of Biotechnology, which was implemented by my organization BIRAC, where we not only looked at a product-driven innovation, but we took a step back to develop an infrastructure to a product-driven innovation. When you develop a medical product, if you don't do a good clinical trial of that medical product, it doesn't make sense. If you don't have a clear regulatory pathway for that medical product, it doesn't make sense. So the National Biopharma Mission created that. And obviously the discussion is on to see what is the next phase of the...
what could that be? What is some sense that you can give of?
So we have to see, it was initially start with 1,500 crores investment. And that doesn't, so we need to literally enlarge its mandate, take bigger programs. We gave out 2 vaccines from that. We gave out 1 vaccine from Grand Challenges. So I think, as Sir mentioned, we need to work on neglected tropical diseases. We need to work on various other elements as well. For a country size of India, it was a one stop of initial setup to see whether that model works or not. As you said, the model was literally working. It literally handholded innovation from the very bottom of the pyramid and we worked from a startup to a large company as well.
So next we can look forward to what? A higher scale of operation or different disease format?
The scale comes if the innovation is successful. And for the scale, everything is ready if you have, as Sir mentioned, the data behind the good clinical practice, the data is good. So you can go up to scale very fast. So we need to really first make your bottom of the pyramid strong with the innovation, with good data, with good scientific evidences. When that is strong, scale it up is very fast. We will take it up very fast. And that's how the National Biopharma Mission, the Grand Challenges model, which delivered the HPV vaccine, that it has been a really very, we did the program. So we took it up. So now next phase will be there. We are deep diving in what are the learnings. We are talking to all the stakeholders, what they want the next. So a decision will be taken looking into that.
Okay. You wanted to say something, I think.
So 3 very specifics, Mr. Kumar, probably would be, One, that health has always been a state subject in the concurrent list, right? So as we move forward, and that's largely responsible for the mess we are in probably. Some states do very well, some not so. So central schemes will dominate, like ABPMJ has emerged as the biggest payer currently, with covering about 3/4 of the population. So that possibly can be a one game changer where a large number of the population can be covered. Two, the emphasis on preventive and promotive care. So we are all aware that 1 rupee spent on prevention may help us in saving 100 or probably thousands later on. So the way our young population is exposed to non-communicable diseases, I mean, we are fortunate to have a very right-sided pyramid kind of a approach. The large population of ours is a youthful, which is our human capital. So unless we modify our ways, adopt best practices, exercise, etc., good diet, there's a danger that we'll go the US way or the Europe way. So that's preventive and promotive care. And government has taken note of that. PMJ also has a third vertical besides ABPMJ and ABDM. There's a health and wellness centers. And so that is, they have now, in fact, NITI has invited quotations, RFP, for assessing and capacity building these 150,000 centers, besides doing their bit at district level. This is already work in progress.
And who will be doing that?
NITI is coordinating along with Ministry of Health and Family Welfare. We were a small part of that, but many agencies have also offered their services. So this is one next boom which is about to happen. The third thing is the integrated care. We have a very robust Ayush ministry doing what it does at a superlative level. So it's a very well structured, and like China, if we could utilize the services of these lakhs of, so there are, for example, 260 homeopathic medical colleges. There are 500 plus Ayurvedic medical colleges. So barring the treatment part, they are given good education, and nowadays their selection is also through NEET, right? So this integrated workforce, and probably a allied bill taking care of the para or allied workers, lakhs of them.
Yeah.
So if they could be brought to the mainstream or regulated or somehow empowered, then there's no reason why our big and wide country cannot be serviced at a more intensive level. So this is a very specific thing probably which will...
and I think, very crucial. But so from a NABH perspective, we were talking a while earlier. You mentioned the importance of that state working with states. We gave the example of Maharashtra, for example. They have the municipal corporations actually get involved with the administration. But what is holding us back from, let's say, having a national standards which can be strictly adhered to despite working with states?
Yeah, so that's a very valid point. One nation, one standard is something which we all aspire to. Having said that, quality has always been a voluntary process, placed slightly aspirational above the regulatory environment. But you'll be very happy to know that all 22 BMC facilities have enrolled for NABH standard.
All 22?
All 22, including 4 hospitals, including 1 dental hospital, all of them and their entire... so it's being a state subject now, probably the time has come with a central push that some of the states are doing exceedingly well. In Madhya Pradesh, in Gujarat, state of Gujarat, entire ecosystem is accredited, they are following.
But one more thing, when we talk of NABH accreditation, usually same size hospitals, we tend to find that not many government hospitals are NABH accredited. Is there something on that front that we need to...
So government always had different standards, like we have NQAS by NHSRC, we have IPHS, there are probably 50,000 plus facilities which are accredited under NQAS, right? But still there's a push from the government to enroll for NABH for government facilities also.
Okay.
18 of the 22 AIMS today are applicant under with us. 4 have already received the certification. 2 of the biggest Delhi government hospital, central government, Safdarjung Hospital and RML Hospital, they're already certified and they've already applied.
So now 18 AIMS are now awaiting NABH accreditation.
4 units of AIMS New Delhi, because it's a big facility like AIMS Trauma Center, AIMS Burns and Plastic Surgery Center, AIMS Mother and Child Center, they're already certified. So it's a big movement at quality level which is happening. ILBS, IBHAS, Chacha Nehru, Maulana Azad Institute of Dental Sciences. So there are total 14 government facilities in Delhi alone.
So now you have how many government hospitals awaiting NABH accreditation?
Already availed for past so many years, more than 150 plus. Like I said.
But now you're saying that numbers are increasing.
Definitely, they are increasing by leaps and bounds.
Okay, I see.
So it's a huge commitment for them because they don't gain anything out of the TPA network. They're all offering gratis service, funded by these tax exchequer.
Dr. Madan Gopal, this point about, we've discussed this, but given that your background also from Niti Aayog and this, if you can throw some light on this, see this focus on generics that we're there in the country. There's a lot of focus on generics. But when we are talking to some oncologists, they're saying that because 20 to 25 antibody drug conjugates, they're not available. Many of the global pharma companies are hesitant because if there is a generic push, they may be reluctant to enter. How does one deal with the problem of access and at the same time, ensure that latest therapies are administered? How does one crack that problem?
It's one of the important things. As I mentioned, the whole focus is on reduction in out-of-pocket expenses. The earlier studies, it's all evidence-based. It's not that why government is pushing a generic medicine. We should understand that. If you break down the out-of-pocket, previously it used to be 72%.
Sorry?
72% used to be. I think age 16, 17, it used to be around 72% out-of-pocket. That means if the government is spending 3.5 lakhs crores of GDP on health, 72% was coming from out of pocket. That means, to translate into very just general terms, we are having 14 lakh doctors and the population is 1.4 billion. That means 1.4 billion, they are chasing after 12 lakh people and purchasing their health services. That is 78% used to spend from their pocket. It has come down to 48, that means 50% because of various efforts. If you break down the out-of-pocket expenses, 40% is coming to drugs and diagnostics. So that's why you have seen the government is investing into free diagnostics and drug services. And beside that, the people are also purchasing. That's why these generic medicines, because they are cheaper, they can reduce the burden on the people's pocket. It started like that. The whole objective is to reduce the out-of-pocket expenses.
So any specific thing that you think we can maybe push so that...
No, you can always see that first is increasing the number of this generic medicine outlets. Why can't we have more generic medicine outlets right now, 7,000? Can't it be in every village? Can't we have a generic medicine store? Because people are buying it. And if you look at how the practices are there, and most of the budget on the out-of-pocket expenses is on the prescription medicines.
Okay.
So we want to reduce that because we don't want people to have catastrophe due to health events.
Okay.
So it is very pity that we are living in a country where for a single episode, even a well-to-do person or a middle-class person, if some cardiac event or some cancer event happens in the family is down by 10 years. It goes back by 10 years. And they have to work for 10 years to go back to the same financial situation. You think about the people.
So they need access, but at the same time they need new therapies also, isn't it?
New therapies also can be brought out, provided they at least find a way to at least help the government. It's not that saying that this is not, it is not...
Help the government meaning what could say?
That means we have to find solutions. Suppose we have been always talking about and pushing that rare medicine diseases are there and we have to provide service. But have we made any effort to create, as done for the antibiotics, where the antibiotics prices have come down? It's all started from India only. It's not that the antibiotic prices used to be very high. It came down because we wanted to have people, because our people have to afford that medicines. Okay. If you have to have this market, you have to see that how you make the things affordable. Even for the cancer and other medicines also, if we make an effort, then we can obviously make an attempt to reduce the prices. Yeah. But generic medicines, I think we should be pushing so that it's available across the...
So access more important than maybe getting the latest therapy.
The latest therapy also can come in provided the cost and other things are being taken care.
Okay.
We can't be saying that you reduce the cost. You find out a way to reduce the cost so that it becomes a win-win for everybody.
Okay. Yeah, thank you. Dr. Shirshendu, just for the constraint of time now, Just want to check two quick things. Given your BIRAC perspective, two things when we talk to hospitals and generally when we talk to people who are looking at, say, BIRAC funding, they say between the grant letter and the actual money leading into the bank account, it's a long process. Is there anything that can be done to kind of speed that up? And secondly, the last point is this concept of biofoundries, manufacturing as a service and all of that has been there. Is it taking off? Some perspective on that? And then we'll have a final concluding note from all.
Sure. I think, in this government system, we have process of, after the funding committee, we have financial due diligence, legal due diligence, and the fund release. Now we are trying to reduce that time period, and from the leadership level itself, that has been directions that everything should be completed in around 150 days time from the call announcement to the fund release. So systems, government systems have been improved a lot. We have gone online. Everything is tracked now. What everybody. So that has literally been managed, and slowly from this 150 days, we are trying to target it to bring it lower down. But there are some processes which need to be handled. Almost 2,000 to 2,500 applications per year. We fund around 800 to 900 grants per year. So it's a process which is followed, and we are also, because innovation, if it is delayed, it loses.
It's of no use.
So we also understand that, and we are trying to improvise ourselves. There are two ways of funding which we try to. One is spray and pray. Spray and pray.
Okay, spray and pray.
We call out an RFP.
Yeah.
And then the RFP, there's a review mechanisms, and then the fund is selected, and then you look at 6 months, 8 months, 2 years, 3 years, what the result come. And one other mechanisms we are looking at, and that is a trial we are trying to do, is called hunt and fund.
Okay.
If there is a very important innovation, which around COVID time we did, and Dr. Madan Gopal knows it very well, where we looked at, we need an X device, we need an X diagnostic. We literally identified good groups, we connected them to a startup or a company, helped them to write the grant application, come to a review committee, get it reviewed, and if it crosses, we fund it. So that is called hunt and fund, which literally will help the innovation to make it to the next level. So that is the thing. And also the biofoundries, you think that is a very important thing. The leadership is taking a keen interest. You will shortly hear we are trying to create biofoundries where the startups can use those biofoundries to literally scale up innovations. We are trying to develop that across the country with bases around east, west, north, south, so that the innovations can quickly take up to the next level.
Just the last bit, I think, just the elephant in the room is essentially the AstraZeneca announcement today about COVID and the vaccine. Just as personally, as healthcare professionals who've understood healthcare and seen for a long time, your personal thoughts in terms of when we look at a thing like this, an important ailment cure or a preventive thing like a vaccine, and then this thing about a shocker in terms of the adverse impact. As professionals from the healthcare sector, what would your thoughts or message be to healthcare companies? Or your impressions, just personal impressions. I mean, I'm not holding your organizations to it.
Yeah, so every vaccine has a side effect, right? Even the water on your table probably has more side effects. So that's part of the parcel when you give, and each vaccine goes through a process. Possibly without going into the merits or demerits of the case, there have been undue number of cases of TTS or thrombosis and thrombocytopenia which have been reported. But when you speak of 1 billion doses being administered, probably more, then this is part of the normal. It's very unfortunate that it has led to 51 or whatever number of cases or of TTS and some, but that's collateral damage, right? In vaccine parlance, polio vaccine, for example, there have been n number of wild polio strains which have been triggered. Each vaccine, whether it is MMR or it's DPT or BCG, they have serious. We see Stevens-Johnson syndrome. We see toxic epidermal necrolysis, which are life-threatening complications of every vaccine, common vaccine. Okay. It's only the reason that they come across And this was a life-saving kind of a thing. It was a scenario where Mr. Roshan pointed out how during COVID the industries came together, created a vaccine, it got administered, and in a day there were 2 crore dosages which were given. So I think we must support the industry there.
Okay.
And the judicial process will also take note. It's not a question of they were wronged or something. Probably now time is right to set the facts right. So each drug or vaccine goes through a certain discovery process.
Okay.
Yeah, and this was the emergency kind of a thing. So
both of you, and we'll conclude with that.
Being sensationalized unduly.
Being sensationalized unduly. I knew media will get the beating in the end.
That's not a thing, because if you look at the way, as he has pointed, I will just pick where he has left. So we have to further substantiate what is the cost benefit of this vaccine. How many lives saved? We should focus on that rather than saying that what are the side effects of that.
Okay.
That should be the approach.
Yeah,
Otherwise,
what
will happen in the hindsight you say that this was not done. You see how many lives were saved.
How many lives were saved?
That should be the... We should try to find out how many lives were saved. If the answer is there, then you have the answer to that question, also wider question.
And maybe in terms of Dr. Shirshendu, in terms of maybe the emphasis on innovation, how innovation should be therefore now looked afresh. Any thoughts? And we'll conclude with that.
As
I've overshot on the time.
Risk-benefit analysis is the key element to it, and we worked around that. The vaccines passed through every test possible in a record time, and it came out. So I think the risk-benefit analysis had a greater say, and that's how it is done. Science will progress, science will evaluate, science will look at it, things will come. But I think that time it was the need of the hour.
Great. So thanks so much. I think if all the award winners today, we'll have to thank these jury members who've actually spent all the time waiting through the application. And thank you so much for sparing time to share your thoughts.